side there. And you can talk out loud. Are we pretty vertical, slightly forward?
Slightly forward.
Yeah. Okay, so again, we're trying to use this posture and alignment things just as cues of muscle performance, okay? So you're going to find things on everybody, so we don't know if it's significant or not, but it's just cues for us to start thinking about what's kind of contributing and what might be a factor, okay? So we see that position there. The other thing we'll look at from a side view is maybe a line from the base of her ear to the base of her nose, okay? You're trying to see if that's horizontal, and then you can make decisions on relative flexion or extension based upon that. So what do you guys think? If we go ear to nose, are we pretty horizontal, slightly extended, looking down? Yeah.
I feel like I have to look like right at you guys.
Yeah. So again, nothing overly significant here, right? Okay. So those are the two things we might look at from the side view. Okay. What we'll look at from the back view is just what we see in terms of prominence and musculature. Okay. So you might think about those intrinsic cervical extensors and see if they're popping out of her neck or anything like that. You know, everything looks fine through here. You do notice from the side view maybe the prominence there. Okay. What's that going to be? Yeah. So what might we think she might be a little susceptible to? Yeah, that translation. So she might be a little bit dominant there when we go to test her intrinsic neck flexors. We might see that chin kind of jut out a little bit. Okay. So those are going to be the things we look at from the cervical spine. What do you think about the cervical curve itself? So we know it should be a little bit extension, right? Yeah. Anything scare you guys here? We're going to turn you so everybody can see. Yeah. Looks pretty normal, right? So we have that normal kind of curve. I'll turn it back this way. Okay, so if anything we see maybe a slight forward position, nothing overly significant, pretty neutral in our head position. We do see a little dominance through here in terms of the sternocleidomastoid, okay? But those are going to be the things that we look at. Now we'll come to the shoulders, okay?
Can I take this off?
Sure.
Okay.